Dear student, welcome to the course MSD 019 Global Strategies to Sustainable Development. In this session, we're going to look into achieving SDG 3 by 2030. I hope you know about SDG 3. If not, let us try to understand in this session, right? So in this session, we are trying to cover what are the different targets and indicators, global targets and indicator of this SDG goal number 3 on good health and well-being. And we will try to understand some of the progress so far made in global context. Again, looking into India's context, what are our policies, program, or any specific project or program implementation strategies in our country to achieve those targets in our country, and we'll look into that. So when we talk about good health and well-being, it is about ensuring a healthy lives and promoting well-being irrespective of in which age you are. And that means in all at all section of the society. When United Nations try to achieve this goal number 3, they identified certain targets, and to look into this target, it has 28 indicators. So let us have a look into that. What is happening in front of us when we are talking about good health and well-being? The major issue, the major causes that affect in our health and well-being is, that is different environmental pollution, environmental degradation. So if you look into some of the major factors, different environmental factors I mentioned, it may be pollution, it may be other aspects which is affecting environment, resource crunch that kills millions of people. And every year, if you look into globally, nearly 1/4 of all deaths worldwide, that is 1/4, right? 1/4, it is because of the environmental factors. So we need to avoid and reduce pollution when we talk about environmental factor, that is pollution of the major factors. Then chemical exposure, climate change, ultraviolet radiations, they contribute to hundreds of diseases that affect a huge different aspect of the people, from child to elder people, right? So we need to find a solution. One of the best solutions is we need to work with energy transport, agriculture industry sector to create a healthier environment, because when we talk about environmental pollution, the resource style, the consumption style we are having, lifestyle we are having, that is directly related to what we are talking about: pollution, chemical exposure, climate change, ultraviolet radiation. Air pollution, is the world's largest environmental health that kills 8.5 million people prematurely every year. So we need to adopt cleaner energy to reduce indoor and outdoor air pollution and save the millions of lives. So to look into this, I mentioned that UN SDG goal, it has 13 targets and 28 indicators. What are those targets and indicators? And when you look into the target 1, it is reducing the global maternal mortality ratio to less than 70 per 100,000 live births. So indicators to look into these are maternal mortality ratio, proportion of birth attended by skilled health personnel. When we look into the progress so far made, if you look into the ratio of this particular 3.1 indicator is declined from 227 maternal deaths per 100,000 in 2015 when we implement SDG. It is declined to 223 in 2020, but still reaching our target of 70 per 100,000 live births that require a that require reduction rate of 11.6% between 2021 to 2030. So when we look into this progress of geographically, there are differences in geographically. For example, when we look into sub-Saharan Africa and Southern Asia, this accounted about 87% of the estimated global maternal deaths that's in the year 2020. Worldwide, if we look into the skill birth that attendance that rose from 80% in 2015 to 86% in 2023. That's progression if you look in global average, right? However, significant geographical disparities like in region like sub-Saharan Africa, that needs to be improved, right? When we come into global 3.2 targets, we need to end that of preventable death of newborn children under 5 years of age. So we need to look into the rate of under 5 mortality, the neonatal mortality rate. So because we have to lower down 12,000 live births under 5 mortality to at least as low as 25 per 1,000 live births, right? When you look into this, the progress so far, when we compare from 2015 to, as per report of 2023, SDG report, 2015 to 2022, now we'll see the number of global under 5 deaths was 4.9 2022. Now it's down from 9.9 million to 1,000, right? That was 9.9 million. Now it is 6 million in 2015. Now it is 4.9 million in 2022. So this is certain, progress we are able to, we are able to take care because of the advancement in knowledge and an effective mechanism using technology. When you look into target 3.3, that is, and the epidemics of diseases like AIDS, tuberculosis, malaria, and many more neglected tropical diseases like, and we need to combat hepatitis, then waterborne disease, and many more communicable diseases. So we need to look as an indicator about number of new HIV infection per 1,000 unimpacted population across different parameters, tuberculosis incidence per 100,000, malaria incidence per 1,000 population, hepatitis B incidence per 100,000, people's requiring intervention against neglected tropical diseases. So each country, they have their own policy program. When you look into the progress of this goal, it is mixed. If you look into mixed response is there. So if we look, for example, HIV infection 2022, there were around 1.3 million new HIV infection. That is only few when we compare to 38%. It used to be 38% less than that was happened 2020, right? Then when we look into the global number of people newly diagnosed with tuberculosis, it was around 7.5 million in 2022. It's also because needs to be decreased if you look into globally. But in some country, it is decreasing. Like our country, we are going to already have zero tuberculosis. Tuberculosis free country. So in that way, when you look into this goal of that has, randomly, if you look into regional wise, there are some differences in progress. When we look into goal the target number 4, it is about reducing by 1/3 of premature mortality from non-communicable diseases through prevention, treatment of, and promote mental health and well-being, because mental health and well-being is very much important for achieving all the other goals. So we need to look into this progress. We need to look into the rate of mortality that is due to cardiovascular diseases, cancer, diabetes, or chronic respiratory diseases. And at the same time, when we talk about mental health and well-being, we need to look into lower the suicide mortality rate. So when we talk about one of the targets, strengthen the prevention treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. So the indicators we identify are coverage of treatment intervention, maybe pharmacology, it may be psychosocial, or that rehabilitation in aftercare services of those, the substance use disorder. In the same time, when we talk about some of this, for example, say alcohol. So we need to understand the alcohol per capita consumption, which is above 15 years and older, within a particular specific time frame. Okay. So when you look into the progress of this particular target globally, this drug-related treatment coverage that is decreases from approximately 11% in 2015 to under 9% in 2022. So it is it's very going well. Moreover, if you look into the data on treatment coverage for alcohol use, when you talk about alcohol use, it also varied from one country to another country, but it's about 0.3%. Average global average is about a minimum of 0.3% to a maximum 14% in most of the reporting countries. From in average, so there is no. In some country it has 0.3%, and in some country it is around 14%. Okay. When we talk about halving the number of global deaths and injuries from road traffic incidents, that's also we need to look into the indicators like that kind of death due to road traffic injuries. And again, we have ensuring universal access to sexual and reproductive health care service, including family planning, information and education, and the integration of reproductive health into national strategies and program. Here you will see the indicators of that to look into this progress, and a proportion of women of reproductive age that we usually look into 14 to 49 years as reproductive age, who have their need for family planning satisfied with modern methods. Then another indicator is looking into the adolescent birth rate, that is 10 to 14 or 15 to 19 years per 1,000 women in that age group. Okay, when we look into this specific, this is one of the important indicator, one of the important target. Now, here globally, if we look here, you will see the proportion of women of reproductive age who have their need for family planning satisfied with modern methods, that increased slightly from 76.5% to 77.6% from the base year to 2015 to 2024. So, what it means? It corresponded to an increase of 75 million women of reproductive age using modern methods since, if you look into the base year of 2015 when we introduce or we implement this SDGs. In the same way, when we talk about adolescent birth rate, that is also declining globally. If you look from global perspective, from 47.2 births per 1,000 girls and women that 15 to 19 years in 2015 to 40.7 in 2024. Right. Target number 8 of this goal is achieving universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccine for all. To look into that, we have indicators of coverage of essential health service. Then another indicator is proportion of population with large household expenditure, particularly on health, is a share of total household expenditure or total household income, right? So when we look into this target and based on these indicators, so what we observe is that proportion of the population not covered by essential health service, that is decreased by about 15% between 2002 to 2021. Though if you look into implementation since 2015, okay, we are not able to progress well. It may be because of unexpected or coronavirus global pandemic, right? So we need to cover more people under essential health service scheme, okay, across the world. target number 9, that we are looking into substantially reduced number of deaths and illnesses from hazardous chemicals and air, water and soil pollution, and contamination of those pollutants. So look into that progress. We have mortality rate attributed to household and ambient air pollution, then to unsafe water, unsafe sanitation, lack of hygiene that is due to unintentional poisoning. These are some of the indicators, right? When we talk about another target, that's strengthening the implementation of WHO framework, that is World Health Organization framework on that convention on tobacco control in all countries. So the indicators where we are trying to look into this progress is standardized prevalence of current tobacco use among persons aged 15 years and older. When we look into this, for example, when we look into this particular, in 2022, the global prevalence of current tobacco use among the population as 15 years and above, it was estimated at 20.9%, right? Which we can translate into around 1.25 billion adult tobacco users in the world, right? And then this is decline as if we compare it to the base year of 2015, around 23.9%. Now here also you will find out in terms of number it is decreased by 50 million, right? The target which is listed at 3B is supporting the research and development of vaccine medicines for communicable and non-communicable diseases. That this communicable and non-communicable diseases that are affecting developing country, that also we also need to look into the support of research development to provide access to affordable essential medicine vaccines in accordance with the Doha Declaration on TRIPS agreements and public health. That particular agreements affirms the right of developing country through use to the full provision in the agreement on trade-related aspect of IPR. Right. To look into this progress, indicators are now to the proportion of the target population covered by all vaccines included in their national program. Right. Another is total net official development assistance to medical research and the basic health sector. Then third indicator in these targets are proportion of health facilities that have a core set of relevant essential medicine available and affordable on a suitable basis. So when we look into this target, what we observe based on the report of 2023 of UN SDG, the coverage of the third dose of the vaccine protecting against diphtheria, tetanus and pertussis covered to 84% in 2022. That was an improvement if you compare to the immediate year of 2021. That was 81%. But if you look into 2019, it is below that. That used to be in 2019, we had 86% coverage. So we need to improve, right? Then these are some of the, for example, when we look into the human papilloma virus vaccination rate, that is declining significantly, especially during the pandemic. But 2022, if you do that year, it shows that there are some coverage of vaccination has increased. So, during this pandemic, we had that becomes a barrier in implementation of such policy in program, effective implementation of such policy program. Right. When we look into another targets, that is substantially increase health financing and the recruitment, development, training and retention of the health workforce in developing country. So these indicators are health worker density and distribution pattern, right, in their own country, like especially in least developed countries, small island country. So when you look into this target based on the indicator, recently it was observed that there is a projected global shortage of health worker around 2030 had decreased from 18 million to 10 million. So that may be because of the aging of population that will lead to an increase in health need and further widen that gap. So we need to, improve in that way. And additionally, 1.8 million health workers are needed in 54 countries to maintain the current standardized density of health workers. The point is that at the same time, the interior population aging is also happening. At the same time, the existing health worker, they are also aging. But we are not pumping or we are not giving enough training to with that of the trend of aging people and with that of the need. So there is gaps in there. We need to strengthen them. Another target is strengthening the capacity of all countries, in particular developing countries, for early warning, risk reduction and management of national global health risks. So international health regulation capacity, health emergency preparedness. Again, percentage of bloodstream infection due to selected antimicrobial resistant organisms, they are the indicators to look into this. So when we look, when we look into globally, the progress towards universal health coverage has slowed down as when we look into that target-wise progress. We have observed that thing. So that leaves billions without care and subject to catastrophic costs. As I mentioned, the aging health workforce struggles to meet rising demand from an aging population. So there is a improvement is observed in adolescent but rates and access to modern contraceptives, but it does not get benefit to all women and girls equally. So we need to look into those gaps. Again, if we look into the pollution, death by air pollution, more than 9 in 10 deaths, this is caused by this particular air pollution, especially in lower and the middle income group. Okay, so when we look into this, you will see in these photos, especially when you look into these, 146 out of 200 countries or areas have already met or are under 5 mortality rate, because target we already achieved it, right? This is, you will see whatever we talk, this is the pictorial diagram from the report 2023. When you look into the global progress in some, looking into different, what we discuss on different target, when you look into maternal mortality in target, when we look into consumer communicable disease, look into NCD and mental health, look into road traffic accidents, sexual reproductive health 3.7, then health workforce 3C. The progress is marginal, so we need to accelerate it. See, then when we look into health impact of pollution, we are going well, right? When we look into some of the maternal mortality and universal health coverage, stagnation is there. Then when we talk about management of health risk, some of the countries they are implementing, some are not, so insufficient data is there to look into the global progress. Now let us have a look into the global, what is happening, that as we know that there are significant challenges in achieving those global health goals, and where progress is very slow. In the same time, inequality persists, especially among vulnerable population, and in the same time we are facing climate crisis. So to meet the target under goal 3 by 2030, we need to investments required in substantial way, and the focus area, the major focus are needed to address those challenges, including tackling inequality in environmental factors. Then urgent action is required to protect especially vulnerable groups and region with high disease burdens, right? What exactly we are doing in our country, to achieve this global goal, good health and well-being? We have National Health Mission, we have Pradhan Mantri Jan Arogya Yojana, we have Mission Interdisciplinary, we have Saksham Anganwadi Poshan Abhiyan, we have Pradhan Mantri Surakshit Matritva Abhiyan, we have PM Matru Badna Yojana, PM Jan Anurdi Yojana, National Ayush Mission, Pradhan Mantri Swasthya Suraksha Yojana. These are some of the program we are implementing in our country. So what are those programs? When we look at National Health Mission, it was introduced in the year 2013, right? The main program components, it include, health system strengthening in both rural and urban areas, reproductive, maternal, neonatal, child and adolescent health, and communicable and non-communicable disease. Then again, the Pradhan Mantri Jan Arogya Yojana, which also called as Ayushman Bharat, that was introduced in 2018, aims to provide free access to health insurance coverage for low income earners in the country, right? When you talk about Mission Interdisciplinary 5.0, it was reintroduced in 2023. So it intensified Mission Interdisciplinary 5, it intensified with an aim to extend routine immunization services across the country, right? So with a major focus on children up to 5 years old. So key objective of this particular Mission Interdisciplinary 5.0 is, boosting boosting measles and rubella vaccination coverage. When we talk about Siksam Anganwadi and the portion, means Prime Minister overarching scheme for holistic nourishment, that's also called as Abhiyan 2.0, that was introduced in 2021. It focuses on maternal nutrition, infant and a young child feeding norms, treatment protocols for and wellness through Ayush practices in reduce wasting and underweight prevalence, beside stunting and anemia supported by this portion tracker, right? Technology implementation. Well, then another scheme that introduced in 2016 is Pradhan Mantri Suraksha Matritva Abhiyan PMSMA, to ensure comprehensive and quality antenatal care to all pregnant women on the 9th of every month, right? In 2017, we introduced Prime Minister Matru Bandhana Yojana that provide financial assistance to pregnant and lactating women so that they their children can get better nutrition. PM Jan that Asaundi that scheme that was introduced in 2008, right? That's also known as in 2016 rebranded as Pradhan Mantri Bharatiya Janasudha Pariyojana to expand the scope of that PM Jan that Anusari scheme introduced in 2008 and strengthening its mission, providing quality generic medicine at affordable prices to the public, right? When we have National Ayush means Ayurvedic, Yoga and Naturopathy, Unani Siddha and Homeopathy Mission 2014 to promote Ayush medical system and provide cost-effective universal access to Ayush services. So when we talk about Pradhan Mantri Swasthya Suraksha Yojana that was introduced in 2003 to address regional imbalances in the availability of affordable, reliable, tertiary healthcare services in the country and to promote quality medical education. We have, as I told you in the beginning, Pradhan Mantri TB Mukt Bharat Abhiyan 2022 that reintroducing it. We are more or less TB Mukt country. We have Anemia Mukt Bharat that was introduced in 2018 to free from anemia disease. We have Janani Suraksha Yojana, which was introduced in 2005 with an aims to reduce maternal and neonatal mortality by promoting institutional deliveries among poor pregnant women. So it's a 100% centrally sponsored scheme. So by introducing such different policies program, now if you look, for example, when we look into strengthening these to promote or strengthening all the schemes, we have, if we look into budget allocation, we have 2016-17 we had 1,323.60 crore. Now in 24-25 we have 3,001.73 crore budget in our budget. So when we look into tuberculosis, as I told you, that is 1,800,000 population. It 208 now it is 199 in 2022. So in that way, this picture shows the status of our progress so far. So by implementing all these policies and program, we have identified our own targets, national level under the global umbrella target. So by through this, if you look into performance states and the union territories indicate that the union territories in our country, you will find out here Gujarat tops with a score of 90, particularly is in this SDG 3, right? Among the states you see, then followed by Maharashtra, then Laos is Madhya Pradesh with 56 score. When you look into union territories, Delhi with 93 score, top among the union territories, and Puducherry 65, lowest among the union territory. So in this way, now Delhi and the Gujarat is top among their category. So you will see here how our progress is improving. Here you will see red indicate aspirant, that red color in this map. Then that score 0 to 49. Yellow indicate performer, that score 50 to 64. Front runner is 65 to 99. That's indicate that is represented by green, and blue color, light blue is achiever 100. So you see how the map changes from 2018 to 2023-24. If you look in 23-24, most of the stats is covered by green, right? And if you look into 2018, a number of states are with red mark, right? This is how we are progressing in this goal number, that goal number 3, global goal numbers 3. So many details you will find out in UN SDG site and our Niti Aayog site also. With this, I would like to summarize in this way that as far as these global targets indicators are concerned, we try to understand and brief about what are those global targets and indicators. In this approach to achieve this goal, what are different policy programs in our country? At the same time, we also have discussed that different performance of different stats with reference to different targets of these goals. So for details, I encourage all of you to be regular in SDG India Index Scoreboard that is available online, because whatever we discussed today in this session is based on a report, a test publication that is in 2024 and from 22, 23, 24. We compile from that. So in next year, it may be this status of those progress will be changing. So with this, I want to conclude that again, with this word, I want to conclude this session that please be updated by, exploring yourself on this status. From time to time, these are some of the references I use, and you can look all these references. Okay, thank you very much.